Hello everyone. Welcome to today's episode. I'm Mia. And as usual, I'm joined by Leo. We're the hosts of Everyday English Hub.
Hey there, I'm Leo. So, Mia, what's on the agenda for today?
Today, we're discussing OCD, which stands for Obsessive Compulsive Disorder.
OCD. I've heard people joke about it, saying things like, I'm so OCD, just because they like neat things.
Yes. But OCD is much more than just a preference for cleanliness. It's a serious mental health condition that can significantly impact people's lives.
Got it. So, today we'll break down OCD in simple terms. No jokes, just the facts.
Exactly. We'll cover what OCD really is, dispel some common myths, and discuss how it affects individuals. Let's dive in.
Let's do it.
First off, what is OCD?
I hear people mention OCD all the time. But what does it actually mean?
Great question. OCD stands for Obsessive Compulsive Disorder.
Obsessive, what now?
Obsessive Compulsive Disorder. It involves having persistent thoughts that are hard to control.
Persistent thoughts? What kind of thoughts are we talking about?
These can revolve around germs, safety, or the need for things to be perfectly in order.
So they worry about these things a lot?
Exactly. These thoughts are termed obsessions, and they can be very distressing.
What do people do to cope with these thoughts?
They often engage in repetitive behaviors.
Compulsions? Can you give me some examples?
Sure. Common compulsions include excessive hand washing or repeatedly checking if the door is locked.
So they feel compelled to do these actions?
Yes. It provides temporary relief from their anxiety, but only for a short while.
And then the worry comes back?
Exactly. It creates a frustrating cycle.
That sounds exhausting.
It really is. OCD can make everyday life quite challenging.
So, it's not just about being tidy or organized, then?
No, it's much more serious. OCD is not a simple habit.
Thanks for clarifying, Mia. I didn't realize it was so complex.
You're welcome. It's crucial to understand OCD accurately.
Right, so we can avoid making light of it.
Let's talk about some common myths regarding OCD.
For sure, I've heard people say, oh, I'm so OCD, just because they enjoy cleanliness.
Exactly. But OCD is far more than just being tidy.
So it's not merely about wanting a clean space or washing hands frequently.
No, it's much deeper. For those with OCD, these actions feel like necessities rather than choices.
So someone with OCD isn't just being fastidious about cleaning.
Right. They feel a compulsion to do it repeatedly.
Yes, and if they don't follow through, they experience heightened anxiety.
Oh. That's an important distinction. They're not just being particular.
Exactly. It's about managing intense fears or anxieties.
For instance, a person might check the door multiple times, even if they know it's locked.
Exactly. And it's not a choice, it feels mandatory.
Yes. OCD can cause feelings of intense nervousness and distress.
What are some common signs of OCD?
A major sign is having obsessive thoughts, persistent thoughts that won't go away.
So they can't escape these thoughts?
Correct. These obsessions often revolve around specific themes, such as fear of germs or dirt, doubts about safety or decisions, the need for order, scary thoughts about losing control or harming others, unwanted thoughts related to sensitive topics.
Wow, can you provide some examples of these symptoms?
Sure. Examples include fear of touching objects others have touched, constantly worrying about whether the door is locked or the stove is off, distress if items aren't arranged correctly, imagining worst-case scenarios, like driving into a crowd, obsessive thoughts about shouting or acting out in public, avoiding situations that might trigger these worries.
That sounds incredibly overwhelming.
It really is. And people often feel they must perform certain actions to alleviate the stress.
I understand. So, do they wash their hands or check items repeatedly?
Yes. But it's not just a lot, it feels like a rule they must follow. Common compulsions can include excessive washing and cleaning, repeated checking, counting or organizing, following rigid routines, seeking reassurance from others. Examples of compulsive behaviors might be washing hands to the point of irritation, checking the door multiple times to ensure it's locked, checking appliances repeatedly to verify they're turned off, counting in specific patterns, quietly repeating a prayer or phrase, trying to replace negative thoughts with positive ones, arranging items to face the same direction.
So OCD isn't just about being cautious, it's a significant issue. What's it like to live with OCD?
Living with OCD is quite challenging. Many individuals experience daily stress.
Do we have any real-life stories to share?
Yes. I read about a woman named Sarah who has OCD. She feels compelled to check her door lock repeatedly.
How many times does she check?
Sometimes it's 10, 20 times, or even more. She checks until she feels certain it's locked.
That sounds time-consuming.
It is. She knows the door is secure, but her mind keeps racing with doubt.
So it's not just a habit, it's something she can't control.
Exactly. It can cause her to be late for work and leaves her feeling drained.
Has she found a way to cope?
Yes. She started therapy, which helps her limit checking the lock to just once.
Just once? That must be incredibly difficult for her.
It is. But over time, she's learning to trust herself more and feel less anxious.
That's great to hear. Are there other stories like hers?
Yes. Another individual, Jake, also struggles with OCD. He has intense worries about germs.
What actions did he take?
He used to wash his hands every few minutes, which left them dry and painful.
Ouch, that must have been tough.
It was. But he learned to wash only when necessary, like after using the restroom or before meals.
That's a significant improvement.
Yes. It took time. But he's managing to live with OCD without letting it control him.
So people with OCD can find ways to cope.
It's not easy, but they can improve their quality of life. So, Leo, can individuals with OCD access treatment?
Yes, they can. There are various treatment options available. Like what? What treatments are effective?
One common method is cognitive behavioral therapy, or CBT.
CBT? What does that entail?
In CBT, individuals learn to modify their thoughts and behaviors, helping them confront their fears.
So, instead of checking the door repeatedly, they work towards just checking it once?
Exactly. They gradually learn to reduce compulsive actions.
Is that the only treatment for OCD?
No, some individuals also benefit from medication.
Medication? What type?
Doctors can prescribe medications that help calm the mind and lessen obsessive thoughts.
Do individuals usually need both therapy and medication?
Not always. Some rely solely on CBT, some on medication, and others utilize both.
That's interesting. It seems like there's a tailored approach for everyone.
Yes. Professionals help determine the best plan for each individual.
So with the right support, people with OCD can feel significantly better. If someone has a friend with OCD, how can they assist?
First and foremost, they should truly listen to their friend.
Got it. Listening and striving to understand their feelings, right?
Exactly. Avoid judgment or comments like, "Just stop worrying." It's not that simple for them.
Right. I suppose saying things like, "Everyone worries," isn't very helpful either?
Absolutely. Instead, show empathy and understanding. Phrases like, "I'm here for you," or "I know this is tough," can be very supportive.
That makes sense. They just need someone to stand by them.
Yes. That's crucial. Also, Don't pressure them to stop their compulsions, let them proceed at their own pace.
So, no attempts to fix their behavior?
Exactly. Encourage open communication without any pressure.
Alright, Mia, why is mental health awareness particularly important regarding OCD?
Well, many people lack a clear understanding of OCD, which leads to jokes or hurtful comments without realizing the consequences.
Like saying, I'm so OCD, simply because they prefer cleanliness?
Exactly. Such comments can make individuals with genuine OCD feel misunderstood or ashamed.
That's not fair. OCD encompasses much more than just a desire for neatness.
Right. Raising awareness is essential for understanding the real challenges of OCD.
So, the more people know, the less judgment and insensitivity there will be?
Yes. When people understand the truth, it reduces stigma and promotes kindness over judgment.
I love that. We should all strive to learn more and support each other.
Absolutely. Leo. A little kindness and empathy can go a long way.
Well said, Mia. So, let's spread the message and be there for one another.
That's the best way to make a difference. Together, we can foster a kinder world for everyone.
If someone suspects they might have OCD or knows someone who does, what should they do?
The best step, Leo, is to reach out for help. They don't have to tackle this alone.
Even if they feel a bit scared or uncertain?
Yes. It's perfectly normal to feel that way. But consulting a mental health professional can be incredibly beneficial.
And they can determine if it's actually OCD, right?
Exactly. Professionals can provide clarity and recommend appropriate support.
So, no one needs to guess or feel lost. They can receive accurate answers.
Right. Leo. Friends and family can also learn how to support them effectively.
If we notice signs, like persistent thoughts or compulsive behaviors, should we gently encourage them to talk to someone?
Absolutely. A simple nudge to seek help can make a significant impact.
So, listeners, if you or someone you know might need assistance, don't hesitate to take that first step.
Yes. Remember, help is available. And no one has to face OCD alone.
Treatment.
Meaning, actions taken to alleviate an illness or issue. Example, the doctor provided treatment to help her feel less anxious.
Therapy.
Meaning, conversations and exercises aimed at improving mental health. Example, he attends therapy to manage his stress.
Fear.
Meaning, an intense emotion that arises when faced with danger or worry. Example, she feels fear when speaking in public.
Patient.
Meaning, a person receiving care from a healthcare provider. Example, the patient expressed their concerns to the doctor.
Support.
Meaning, assistance offered during challenging times. Example, her friends provide support when she feels down.
Professional.
Meaning, an individual with specialized training in a particular field, such as healthcare. Example, a therapist is a mental health professional who assists individuals.
What role do mental health professionals play in assisting those with OCD?
Mental health professionals, like therapists and psychologists, guide individuals in managing OCD. They teach skills to cope with stress and diminish obsessive behaviors.
How can friends support someone with OCD without putting pressure on them?
Friends can contribute by listening and exercising patience. They should encourage the individual without forcing them to halt their behaviors or seek help prematurely.
That's all for today. Thank you for spending time with us.
We hope you found this discussion insightful and enjoyable. Please share your thoughts in the comments and pass this episode along to your friends.
Keep following this for more engaging episodes. Have a fantastic day, everyone.
Goodbye. And see you next time.